Hi there. This brief tutorial is meant to assist you in learning to do Bastrika Pranayama, which is a very energizing breath work. So it's great for enlivening, cleansing, stimulating. It's useful in increasing circulation, opening up, awakening, lightening. It's great when you're feeling sluggish or kind of lethargic, or if you're kind of stuck in an emotion, a belief, in an image. It kind of gets rid of some of that. So it can be useful in letting go of some habits as well. That being said, there are a lot of contraindications for this. So I'm going to read a few of them here. And also, of course, you want to do warm-ups. So I would usually do about 10 three-part breaths. That's your Dirgha. Inhale, fill the belly, the ribs flare out up to the collarbones. Exhale, reverse. If you want to add the ocean sound, which is like fogging up a mirror, that's called Ujjayi. That's up to you. Generally, I would do some Kapalabhati or skull shining breath in between. That's our those kind. You also don't want to do this breath work if you have a full stomach. You don't want to do it late in the day. It's considered the most energizing. Okay, there's different ways to do it. We'll do a couple of different arms, but that being said, you don't want to do it if you're pregnant, if you're nursing, if you've had recent abdominal or chest surgeries, illness, respiratory sinus infections, asthma, COPD, emphysema, pacemakers, uncontrolled high blood pressure, any ear infections, nosebleeds, obviously cold, flu, illness of any kind, acid reflux, if you have any abdominal cramping, discomfort, menstruation, if you have A-fib, tachycardia, MS, precautions, if you have epilepsy, glaucoma, vertigo, any kind of unstable emotions that can be as simple as not having enough sleep, if you're having some grief, and of course, anxiety, depression, PTSD. So that being said, I'm just gonna take a few breaths here. So the first time I'll do no arms, so that can be a little bit easier, especially if you have any shoulders. The second time, I'm going to be doing arms out and then pulling them in. And the third time, I'll alternate back and forth. It's a forceful inhale and a forceful exhale. Usually we begin on the inhale, but the effects will be the same either way. So and then deep breath in, let it out, maybe a resting breath or two. And then we'll do the second arm one. So and deep breath in, let it out, and final one. And deep breath in, let it out. Of course, you can be doing internal or external breath retentions known as kumbakas. That's another story. You can engage the locks if you're doing that, the three bandhas, pelvic floor, belly button, neck. I always recommend just pausing here for a few moments, noticing any shifts mentally, physically, emotionally, and knowing that you should probably stay seated for a few moments after doing so, because it is a tendency to get a little bit lightheaded until everything clears out. You always want to do this practice seated as well. You want to make sure your spine is nice and straight, of course. Alrighty. So thank you for watching. This is Lynn Caputo with Unwind the Mind, Hypnosis and Wellness. Make it a great one. Namaste.